how do you approach either community leaders or the local government or to large healthcare systems? How do you explain the utility of DLT into the opioid solution? How does that fit in?
Well, I think everybody wants to find a solution, right? But both legacy institutions and innovation together, first to educate and then try to incubate ideas. Solister, obviously, we're doing something very similar in terms of trying to create real-world solutions. It's been an education process. And so, like, for example, Change Healthcare, which is the largest company in the U.S. that manages payments and claims based out of Middle Tennessee, has incorporated on Hyperledger, on Fabric, a kind of an internal blockchain. It's a closed permission system, so it's not sexy, it's not open and permissionless, and kind of all the things we think about at full scale. But you're starting to see some of those things, Alex, and part of it, true, to be honest with you guys, is they don't want to be left behind. So there's this kind of this thing that's happening where they don't want to be left behind, but they do want to be part of the solution. I think it's an ongoing process in terms of engagement with enterprise.
Yeah. So education and patience. And John, I think one of the most interesting things with Orion Behavioral Health is that it's a long-term treatment. It's not kind of those acute detox and then you go back to the community and surprise, after 2 weeks you're back on it again. How do you see that connection between technology that you use, the virtual care, and the need for high touch in addiction? How does that work?
Well, it works in that in today's day and age, not just healthcare, but it works in that they have to be combined. Too often we think of the human approach or we think a technological solution to replace the human approach. And what we have learned, again, I'm not on the front lines, I'm not a clinician, but the human element cannot go away. I saw it was a great definition of addiction in some TED Talk that people interested in the subject may have heard once, and the presenter said the opposite of addiction is connection. And so human connection is absolutely an important element, and technology, as we all know, because so many of you are on your phones right now, connecting to someone. Technology is an enabler of that type of connection. If you use it right, the right time, in the right place, in the right way, it can really augment the impact that trained professionals can make on people in need.
I appreciate that, and it fits into what yesterday on the main stage we said that the opposite of health is isolation and the need for connectivity. And I know that you guys are on phone because you're tweeting what a wonderful panel this is and making everybody know. So we encourage you to continue. Justin, BlockMedX, e-prescription, interesting. There's this element of DEA and enforcement in all this. How does that work? Is it something that is more adversary, or is enforcement part of it? I'm trying to kind of figure out how does that fit.
Yeah, a lot of people don't think about the regulatory oversight part of all this as much. A lot of the focus is on preventive care and then treatment solutions. But when you think about enforcement, HR 6 recently called for a system to flag suspicious orders, right? And how does a lot of this happen right now? It's a manual process. A lot of the times you'd be surprised it's really just someone in the back office going through a bunch of Excel spreadsheets and being like, that looks off. Let's look into that. But with BlockMedX, what we're doing is we're gathering clean data sets, and we're able to run predictive analytics on it, and we're also able to flag statistical outliers, and then share that information with the proper law enforcement authorities.
So that's a really interesting aspect, that you have that regulatory and to make sure that we can identify bad actors. But also what I'm hearing between is if you're able to identify aberrant behaviors maybe of patients, then we could kind of send them to treatment and see that. So that's really interesting.
So that's actually that is the main patient outcome that we're seeking, right? We're trying to stop addiction before it happens. And the powerful thing about machine learning is if you have quality data sets, you can predict these behaviors, these patient risk behaviors, and stop ED visits, stop hospitalizations long before they occur. We often forget that a lot of patients who become addicted, they're not malicious bad actors, they're not junkies, they're people who are taking the pills that were prescribed to them, and then after a certain threshold, they become addicted. And most don't even know that they're addicted until it's far too late.
That's really great. Thanks so much. And Steve, well, first of all, thank you for coming, and the whole Preventum team, all the way from Australia, so I don't want to even imagine what time zone you're in. But talking about that engagement and stigma that has to do with this, really what you're doing with FEND and involving young people into this. Tell us a little bit about how do you include folks to kind of join your ecosystem?
So it's really interesting. I met with a blockchain company in Melbourne, Australia recently, and I think they had done a $30 million ICO last year. And one of the things that the CEO was saying to me is, well, how do you get customers? I thought, really? You didn't figure out your customer acquisition model before you did an ICO? And so that's a whole different discussion about getting your business model straight. But in terms of engagement, one of the things that we know is, we like to think of it as using the same tactics that big pharma or big tobacco would use in terms of understanding their audience and speaking to their audience. And a great example of a group that's done this is Truth Campaign with smoking cessation. And now they're doing some great work around opioids as well, engaging youth. And one of the things we try to use is those same marketing techniques. So for us, those three marketing messages that we all know when we're out selling, first of all is the altruistic message. There are going to be some youth who want to join FEND and join the campaign because they want to give back. They want to make the world a better place. They want to get rid of opioids. Then you have that kind of marketing message of the fear of missing out. And we provide experiences that money can't buy. So one of the things we did this summer is we partnered with a music tour called the Vans Warped Tour. And it stopped at 38 cities around the US and Canada. And we gave away free concert tickets, backstage passes, private acoustic sets. We have a streetwear brand that kids can get, ball caps and hoodies and t-shirts and start to wear that brand and be proud about that. So that fear of missing out. And then the final one is what's in it for me. And that's where when you do use gamification, and you know this with the micropayments, Justin, when you use gamification, you're able to speak to whoever your audience is and say, okay, so what is it that you want? What will motivate you? Now, gamification is a big term. It's thrown around a lot. It's easy to say, and we were talking about this yesterday, Alex, about, well, if you're going to be responsible for your own health and lowering that cost, then shouldn't you share in the profits of you being well? And that's a great motivator. But on a small scale in prevention, gamification can be powerful, and we can answer that question, what's in it for me? It's not only, though, providing free concert tickets or free swag or a chance to win a free iPad or Amazon gift cards. Those are the extrinsic rewards, and what the research shows is that those will last for so long, but until we have an intrinsic value placed on that person motivating and moving beyond the extrinsic, and they internalize that, then gamification can fall over. So you have to do both.
Just jump on that.
Go ahead.
Yeah, so that's what you're talking about is so important. You've long known that patient engagement is the holy grail of medicine, right? It's a $300 billion market, and when it's economically viable to incentivize people with micropayments, then we can codify healthy behaviors. Right. It exists as much in literature as I guess now in practice with what you're doing, but literature has shown with a diabetic population that you can increase medication adherence by twofold with as low as $1.40 a day. And so I do think it's really cool that you have like a content-driven model and you're targeting youth and using all these cool little gamification.
Yeah. Taking that one step further, John, with your experience also with the insurance industry and payers, what do you feel is their appetite for these new models of incentives, with blockchain, without blockchain, it's like, how do you feel, that they're running these huge businesses, they do projections to the future, what is their appetite for going with this?
Yeah. Well, their appetite is huge. I think Justin summed it up, and we all know this in healthcare, that patient engagement is the holy grail. As a matter of fact, I remember we did we have national contracts with a couple of the largest national payers, and I'll never forget, one of them said, your platform is by far the most clinically sound and technologically advanced we've seen, and we should get this to as many members as possible, as soon as possible. The only question in our mind is the extent that which you can engage them. All right, so that's always, so to answer your question, is they're very interested. I mean, in the day of value-based payments and controlling outcomes and the importance of personal responsibility and behavior in dictating whether or not your health outcomes are good or poor, which means your costs to the system, including to the insurance company, your employer, or your pool, or just your own pocketbook, takes a significant hit is absolutely critical. So I think all the stakeholders, including the insurers who, there's a cynical view of what the insurers care about, but absolutely they care about that.
Well, it's good to hear, because sometimes, especially from a patient perspective and provider perspective, it can be a little bit daunting. Stuart, working in the crypto space, what would you say, because blockchain can do a lot of things, but what is the most salient feature from it that you would say is the most helpful or relevant to this opioid problem? Is it the immutability, the interoperability? What is it when you go and you want to design or sell it? What is that feature?
Well, I think it's a really good question, and I think automatically a lot of people think, well, can you tokenize something here? And that's not the right question to ask, right? It's like, can we leverage the technology to do something meaningful? We already have prescription monitoring programs. I think almost every state has a monitoring program, right? So we have the technology to track if someone's abusing the system. Either if there's a physician that's over-prescribing, we see the CDC, you can go to CDC, they have a whole opioid kind of venue where you can look at the statistics. We know where the over-prescribing has happened over the last several years. We know the history of how this kind of started. And we know patients, theoretically, that are abusing the system, that are doc hopping, right, going from state to state in some cases. I think it is a track and trace. I do think it's an incentive model, Alex, of some regard, but people have to remember something. When somebody's addicted, they don't care about incentives. They just want the high. So you have to think about, okay, can we do something kind of Steve and I were at Consensus Health a couple of weeks ago, and Victoria shared some of those statistics. It's like, what do you do with an incentive model for an addict, right? But I do think there are some incentive models for the physician teams and the rehabilitation teams that could be really interesting to stay committed to the process to keep people clean. The track and trace thing, I think, will continue to get better, though. I think that's still an opportunity to connect it all, if that makes sense.
And maybe family and support system.
For sure, yeah.
So we have, time is flying so fast, this is a great conversation, so let's do one more round and leave a little bit for the audience. So Steve, I know you're moving from state to state. Tomorrow you're going to Utah, you have Rhode Island. I was talking to Governor Raimondo. She said, you must know about Preventum and Virginia and all this. Is this like a global thing, or is this just a U.S. thing? Or yesterday I used the word affluenza, countries that just have too much. Is it a country that has too much? How would you our next panel will be about global impact, but what do you see as a cultural phenomenon?
Well, I think the U.S. loves to do it big, don't we? I mean, I'm originally from North Carolina, but I've been living the last 20 years in Australia, and Australia is a great country to look at things like health systems and social impact, and because it's such a small population, we only have 25 million people, but it has a lot of problems as well. And we've just now had our big 60-minute special, like we've had here in the States a couple of years ago, talking about the rise of fentanyl overdoses in Australia and how that's now going to pass the ice and methamphetamine overdose and addiction. And it's scary. And so I think there is a cultural thing here, and we're trying to get to the bottom of this. Part of what we're trying to do with FIND is just basic education. When we started FIND, we did some early research with high schoolers and asked basic questions like, well, what is an opioid? You know, what happens if, you know, you're drinking a beer at a party and someone gives you an oxy? And fentanyl was considered a party drug. And this is scary stuff. And so this is not like weed or some of the other things. So the other thing we wanted to do is make sure that we're not preaching, because this is not about us. You know, this is the whole argument with blockchain too, is that it becomes a ground up a movement, and that's what we're trying to create. So I think the social impact is, and I hope the panel next can talk about that, and I think it's huge, but I don't think it's just a problem that's limited to the US, but we definitely have made it we've perfected it.
Well, briefly, Justin, is it a generational thing?
A generational? No, I don't have any statistics offhand, but we know that doesn't discriminate. You're right. And just to kind of add on to that, it is worse in the United States, but we know that countries like the UK are not far behind, and many legislators there have described the situation as being like kind of the 2014 over here. So we at BlockMedics have actually secured a national pilot test with the government of Taiwan, which is a single payer system, and we're hoping that that's going to be a good proof of concept to bring back here domestically, so that when we speak to legislators here, we can show them what's going on. And then just one more thing to add to what Stuart said about the most important part of what can blockchain do, right? Everyone knows that blockchain is inherently more secure, but that's really important for services like EHRs and e-prescribing platforms. Last year, all scripts went down in January, and a lot of hosted sites couldn't access these resources for days for a $40,000 ransom. You know?
Our time's almost up. Anyone from the audience want to ask our panel something? Yes.
Hi. I'm Hajal. I am Chief Operating Officer of a manufacturing company that's part of the supply chain for auto injectors. And then my brother-in-law passed away an opioid overdose in June. So it is a subject that's kind of near and dear to our family. But I have a question about the gamification. You had talked to someone about diabetes, but I feel addiction is a different sort of animal in the sense that once an addict is an addict, it's very easy for them to branch out into other addictions. So I've seen with my own in-laws. So my concern comes from when you talk about incentivizing using gamification models. Has any consideration been put on the fact that you may be trading one addiction for another addiction?
So the question is for the sake of it's taken on the video briefly, and we'll finish with that. First of all, condolences for your loss, and every time we hear it, it just chagrins us, and thank you for sharing. The question was about gamification and how specific and special it can be for addiction, so...
Can I jump in real quick?
Yeah.
In looking at that question, it's a great question. I think it's important for all of us to understand that addiction is a very broad and universal issue with all of us. And in hearing from lots of addicts, opioid addicts in particular, but addicts of all types, they oftentimes in recovery trade one addiction for another. And that is how they actually recover. And only in a state of health and clarity, while having an addiction maybe to coffee or maybe to working out or maybe to lots of other things, can they move themselves to a more balanced and healthy lifestyle. But I think you're absolutely right that trading one addiction for another is absolutely part of it. On the Araya platform, we see that in the outreach to people. We see some people become addicted to their therapists. So that can happen. So it's not necessarily a bad thing, I guess is in a nutshell. It's how you transition people to, staying alive and living a fulfilled life.
And I'll just add, one of the big challenges, of course, the opioid crisis, if we look at the three kind of big areas that we're addressing, is prevention, treatment, and recovery. In prevention, gamification, and particularly in injury prevention, and Jackie, who will be up next, is really the global thought leader on using gamification in injury prevention, and her research has been around that. That's actually proven to work, and there's some great outcomes you can get with education and prevention. In terms of treatment and recovery, with recovery, there have been there's been work around things like contingency management for other types of addiction, cocaine, alcohol abuse, and addiction. And there is some exploration in looking at opioids right now and opioid addicts using a theory called contingency management, which is using a type of gamification, but it reinforces the behaviors in that recovery and treatment plan. Going to counseling, attending family therapy sessions, showing up to work on time, clean and sober, all of those types of activities as a part of recovery. There is some early research now happening, and I know Consensus is doing some cool stuff around that as well.
Great. Well, listen, thank you so much. Thank you for the panel. And